Hi everybody, Dr. Brighton here for Two-Tip Tuesday. Today I want to talk about antibiotics. A couple things I want to talk about. One, some misconceptions with antibiotics, and two, how to properly use antibiotics. So first thing I want to talk about is some misconceptions with it. I get a lot of questions with patients that have tooth pain where they assume that they should be using an antibiotic to take away pain. First thing first, I want to address that. That's quite a big misconception. Antibiotics are not a pain medication. Antibiotics work to fight a bacterial infection. And so in any scenario where you've had an antibiotic and you've seen pain relief, it probably didn't come for anywhere from 48 to 72 hours because the antibiotic was taking away part of that bacterial infection, and then as a result you saw the pain go away, but it wasn't actually treating pain. So I want to kind of get over that misconception that antibiotics don't fight pain, they fight bacterial infections. Second thing I want to talk about is that antibiotics do not take away tooth infections. They help to treat them in certain circumstances, but they don't actually take away the bacterial infection. Unfortunately, like other parts of the body, you need an antibiotic to kind of contain the bacterial infection, but you actually have to go in and remove it. And that's why you have to do things like fillings. You have to remove the bacteria that's in the tooth, and that cavity is formed, and you fill it in. Or you need a root canal to go in and actually strip the bacterial infection from the inside of the tooth. So antibiotics do not take away tooth infections entirely. They just kind of contain it to some extent. And then the last thing I want to talk about is uses with antibiotics. So antibiotics, believe it or not, have somewhat of a limited use where they're actually effective with regards to tooth problems or tooth infections. What we're finding is that antibiotics can actually have a higher rate of the development of either resistance, so throughout lifetime you may actually find that an antibiotic is no longer helpful during infections because it's been overused, or even an allergy developed as a result of overuse, and the odds are higher in some instances that will happen rather than it actually helping you or being necessary for certain tooth infections. So as a result, believe it or not, antibiotics are used less and less in dentistry because we're finding they're not really helpful. They're not really functional per se. And so just wanted to address a couple of those things. There are still certain circumstances where they're necessary. If you have a patient who's what's considered immunocompromised, their immune system isn't as strong. So we see that with diabetics. We see that with people that have or are receiving treatment for cancers, that they might not have the ability to fight infections so well. An antibiotic can help them with regards to tooth infections in certain circumstances, but they're still even limited to only certain types of infections. So hopefully that's helpful. If you have questions about it, please comment below, call us, email us, but we'd like to interact with you on that, or share it with somebody you think it might help. So hopefully that's helpful for you. Have a great rest of your week. Thank you for tuning in.